recording now, so
hmm
you're just gonna introduce yourself and tell me a little bit about who you are, and then I'm gonna ask you
hmm
these questions. Basically,
Yeah, of
I'm
course.
just gonna
Sounds good.
it's just gonna be a conversation,
Yeah,
essentially.
sounds good. So my name is Sophia Taglia. I'm one of the co-founders of Biomotion London. A bit about my background. So I graduated in pediatric medicine, and then I went on to specialize in sports and exercise medicine. I've got a very strong focus on biomechanics, hence why I've created Biomotion Movement Lab.
Amazing. And when did you start your journey within this?
So the idea of Biomotion London, I would say probably about 5 years ago, whilst I was studying. I thought it was quite a niche. There's not many clinics that focus on movement health. And then it kind of came into place, I'd say a couple of months ago. So it's very, very new.
I love that. And how often would you say you think about how you personally move?
I mean, I'm quite an active person. I think movement is so, so important. On a daily basis, I'd say. Definitely every day. Yeah.
Yeah, and also you mentioned before that you used to be a runner, so I suppose that
Yeah.
helps a lot with that.
I used to be a runner. I used to do 100 meters and 200-meter sprints. So I think I've always been quite an active person. I used to be very, very passionate about sports, and that's kind of helped me create this.
And just speaking, did you know that your feet can influence your posture and back pain and even headaches?
Yeah, yeah, absolutely. So, I mean, feet is kind of the ground to walking, the ground to running. It can impact all the way up. It's kind of like a chain. So the way your feet move is potentially the way your knees will move, the way your hips would move, and vice versa.
Right. So what would you say is the most common walking or running pain you hear from people?
I'd say the most common we probably get is plantar fasciitis, which is basically the thickening of the plantar fascia band, which runs along the foot. Um, can happen to anyone really, to women, to men, can be from overuse. It can be, there's lots of factors that can cause it. I probably say we see that a lot in the clinic.
And what would be your recommended step towards healing that, towards that journey of recovery?
So usually it's a combination of different things. Usually patients come in first, we diagnose the plantar fasciitis. Tends to be a combination of rehab, so exercises, sometimes orthotic therapy can help as well, so giving them an insole to put into their shoe. Shockwave therapy also is very effective. There's lots of research on that. Sometimes it can be really, really chronic and not many things help. So that's kind of when you'll go down the injection therapy route. But yeah, lots of different things we can do.
Amazing. And if your body could talk based on your last workout, what do you think it would say?
Um, I actually tried Le Gris yesterday, which is
Ah,
not Pilates, is completely different. It's very like slow movement, but your body's constantly under tension. And yeah, today my body is screaming at me, but it was definitely good. Yeah, it was really good.
well, since your body is screaming at you, would you say that pain during exercises is a good thing? And should people push through or should they stop?
Um, I think pain is a bit of both, I'd say. You don't want to be in a lot of pain. I think a lot of the time it's actually a mental battle you're trying to push yourself through rather than a physical battle. Obviously, running long distances could be a bit of both. I don't think you should put your body under too much stress. But yeah, just a good balance between both, I'd say.
Well, is there a health injury that you've never had or a body injury that you've never had, but you've never thought should be attributed to running or walking or utilizing your feet?
In terms of injury,
Yes.
I mean, injury wise, anyone could get anything. Basically, it can be something that they broke their leg as a child and now things slightly healed differently and now it's kind of playing a factor of the way they move. It can be anything. The injury can basically be anything.
Right. So at what point should somebody or an individual stop and seek self, well, when should an individual start self-diagnose or get professional help?
Um, I think it depends. I think for us, what we're trying to promote is to come to us when you're starting out. So, say if you're trying to get back into sports or you're quite active and you want to know more about the way your body moves, I think that's what I'm trying to promote is for people to come early before they have any symptoms, so we can do the whole assessment, they can understand how their body moves, they can get really valuable data, and then work on strengthening these areas and not to get any injuries. We do also get a lot of patients who come in with an injury. So as soon as you start to get pain, I'd say kind of within the first few weeks to come in, then we can diagnose what's going on. We can do, for example, the analysis of and see the way the whole body moves, see if this is the kind of an area that loads a lot, and then work on preventing that in the future.
Yeah, I definitely do agree with that. And I remember when I was at the practice, I thought I
Mm,
was running just fine. I thought, because I've been running for such a long time, for over
mm,
7 years, I thought there was nothing wrong. But
yeah,
through the results, we've realized that I was putting a lot of pressure on my left hip and my left
yeah,
joint, and I mean on my right joint. If anything,
hmm,
my left side was a lot better than my right, which was
yeah,
surprising to me.
yeah. And sometimes you won't notice. I mean, with the naked eye, like looking at the way someone runs, you won't notice these things. They can be sometimes so minor, but the technology we use in the clinic can pick these things up.
And do you think this is something that should be taught in schools? Obviously, at the same time, you do want people to come into your practice and you do want to take care of them, you do want to treat them and prevent them from getting injured in the first place. But do you think society as a whole would benefit more from learning about these things in school as well?
Yeah, I think it's actually quite interesting you mentioned that. We are trying to jump into the school space, so bring this technology to the schools. Whilst they're young, I mean, the kids are still growing. This information might not be too valuable, but once they reach kind of like early adulthood, this is when this information could be really, really useful to them. So yeah, I do think movement health should be really kind of shown in all schools. And this is something that we're trying to do.
I love that. And what surprises you the most about modern biomechanics technology, and what can it reveal about how you move?
I think it's the 3D motion capture analysis. I think it's usually you can, on 2D caption, 2D motion capture gait analysis, you can only see kind of like frontal and side to side movements. But with the 3D, you can start to see how the joints move internally and externally. So in your case, we were able to see how the knee internally rotated, which with technology back in the day, you would not be able to do that. So I think it's just gaining that even more, that information. That's really, really useful.
Yeah, no, I agree definitely because, like I said before, I thought I was fine. I didn't realize there were so many things I needed to work on. And I thought what
Yeah.
was really impressive as well was how you were able to not only analyze what was wrong, but also provide specific
Hmm.
exercises in order to fix that as well, so that
Yeah.
I could get better at running.
Hmm.
I could increase my speed as well.
Yeah.
On top of that,
Cadence. Yeah. I think
yeah,
cadence for you was quite an important factor to increase your cadence. Yeah.
yes, 100%.
Mhm.
And would you trust the data from motion capture technology more than subjective feedback?
I think a bit of both. I think the technology will provide you with kind of all the information you need, but then you also need to have that kind of clinical judgment. Like, is this right for the patient? Sometimes the data could be like increase your cadence or increase your stride length, but that can sometimes play a factor on other areas. So it's kind of using that technology, but using the clinical like your clinical expertise as well, and then create that rehab program for the patient.
Mm. If you were advising people, would you say investing in a health assessment is an expense or is it an investment?
It's an investment into your health. I would say with this kind of motion capture analysis, it's a one-time thing. You can do it kind of early on, and you can do it like a year later, a couple of years later, and see how your body is. It's definitely investment into your health for sure.
Yeah. I don't know if you have any data on this, but I think it will be quite interesting to probably have some numbers regarding to this. But how much do you think unresolved movement issues can cost over a lifetime for an individual, or for yourself in this case?
I'm actually not too sure. Not too sure. It'll be interesting to jump to have a look at this. Yeah, I'm not too sure how much.
Yeah, because
In the
go on.
thousands for sure.
100%. I would not be
Yeah.
surprised on that.
Yeah.
And this was an interesting question.
hmm
If better movement meant fewer sick days and more energy at work, would that change how you prioritize your health?
I think movement is kind of like the fundamental to living. I think the better you move, the better you're going to live, essentially. I think the more you move, the less, I mean, there's lots of research out there with sickness and like obesity, for example. The more you move, yes, I do believe that the less sick days you'll have at work for sure.
It's interesting that you mentioned obesity because something that's been on my mind right now. A lot of people do suffer from that
hmm
as a whole within our society. And what would be a target? Imagine somebody was obese and they wanted to improve on how they walk, especially the more fat you have on your body, the more pressure it puts on your joints naturally when you walk. And therefore that can be and therefore that can be very tedious and painful when you from your back, your legs, your knees, So what would be your advice for somebody who's suffering from too much weight?
I mean, I would say for sure come in. For us, the patients that come through the door are from all avenues. It can be like children, it can be someone who's obese, someone who's injured, someone who's super athletic. It can be anyone. Not all patients run, some patients walk as well. We put the biomarkers on the patients, about 34 biomarkers, and we get them to walk. That will kind of tell us all the data we need to know. And from that, we can give them exercises that they can do to start off with at home. Then it can be exercises that they can do kind of outside, going to the gym. So yeah.
I love that. Well, I'm definitely going to be posting this on social media later on, and hopefully a lot of people will be taking those advice and changing their lives for the better. The final question, this one's more to do with community. And in your opinion, what role do you think community and accountability and professional support play in helping people move better for their life?
I mean, definitely, I think now community is such an important thing. I think online there's lots of run clubs. I mean, yourself as well. Lots of people are trying to promote movements, and I think it's honestly great. I think it's really, really good. We're trying to jump into that community space as well to show people how better movement can basically give them a better life. So yeah, very, very good. I think social media is huge in doing that.
Yes, I definitely agree. And in my experience, community has been literally the bearer of accountability because by being surrounded with people who share the same goals and who are willing to push you and motivate you, it really does help in making you want to, generally speaking, live a better lifestyle.
Yeah, definitely. Definitely. Even in a social aspect, meeting people with the same kind of goals, it's nice.
Yes,
Yeah.
100%. Well, Sophia, thank you very much for answering my questions. These
No problem.
are all the
Thank
questions
you.
I had today. And I look forward to coming back to your practice again
Yes,
next
definitely.
time once I've done those exercises you recommended,
Yes,
and then we'll
definitely.
see the progression over
Yeah,
time.
for sure. Yeah, thank you so much. It's been
My
great. Thank
pleasure.
you.